Now, even though India has crossed the 100 crore vaccination mark and the fear of COVID is ebbing, the dangers are certainly not. This week, several countries, including Russia, the UK and China, and some countries in Eastern Europe have observed a notable rise in coronavirus cases. China has shut down schools, suspended certain flight operations, and Moscow is going into a 7-day lockdown from the 30th of October. Where does India stand in its fight against COVID amid the festive season? Joining us on the broadcast, Dr. Randeep Guleria, the head of AIIMS. Thanks very much, Dr. Guleria, for being with us. I want to begin by asking you about the West Bengal COVID cases, which are doubling in the aftermath of Durga Puja celebrations. Could the festival season trigger a potential third wave in the country?
Yes, that is why we have been always saying that you have to be very careful during the festive season. Because the festive season leads to crowds developing. We saw that during Durga Puja also. And crowds, when people are not having COVID appropriate behavior, can be super spreading events. And that can lead to a huge surge in cases. One needs to look at it from 2 points of view. One is, of course, the increasing number of cases. And does that also translate to increasing number of hospitalization, increasing number of deaths? Because what we're currently saying is that if you are vaccinated, it will protect you against hospitalization and death. You may still get the infection if you go to a crowded places. So that there will be a surge in number of cases if the COVID appropriate behavior is not followed. But we have to be very careful, because in those who are not vaccinated, this could lead to a surge in the number of hospitalizations also.
I just want to draw your attention, to what's happening globally vis-a-vis India. China has shut schools, certain flights have been stopped, Moscow is all set to go into a lockdown. But compared to that, so far, thankfully, cases in India continue to remain low. Why is that?
So I think we had a huge third wave, a second wave, which led to a huge number of cases, and the Sero survey data subsequently showed that we have acquired a good amount of immunity, almost up to the tune of 70% as in various areas of our country. Our vaccination drive is also doing well, and many people have at least got one dose of the vaccine as far as the COVID vaccine is concerned. However, having said that, I think we still need to be very vigilant, because we don't know how the virus will behave. The virus can mutate and it can become more infectious, and there is always this concern that the virus may mutate and become more infectious than even the Delta variant, which could lead to a surge in cases. So I think what we need to do is three things. One is push very aggressively for COVID appropriate behavior, which includes avoiding crowds. Everyone should come forward and get themselves vaccinated if they are due for their vaccine, and that is the other important thing. And the third important thing is very aggressive surveillance, and pick up areas which could be hotspots where you may have a surge in number of cases, and have some sort of a lockdown on containment in these areas so that it doesn't spread to the other parts of the country.
Right. Just a quick allied question, Dr. Guleria. You just mentioned that there are certain parts of our country that have seen almost 70% immunity. Does that in a certain sense indicate that we're inching closer to herd immunity, or is this considered a marker of herd immunity?
So I'm a little skeptical about using the word herd immunity, because herd immunity means that you are immune to the currently circulating virus. So if you say, are we achieving herd immunity to, let's say, the Delta variant? I could say yes. As far as Delta variant is concerned, we have a good amount of immunity. We may not have reached the target for herd immunity. But if the virus changes and we have a new variant, then our immunity to that may be less, and therefore we will have to start from a new level in terms of whether it is 70% or 30% or 40%. Therefore, herd immunity is going to be something which will vary depending on how the virus behaves. As of now, with the Delta variant, we have a good amount of immunity, and we could further enhance that with more and more vaccination.
Right. So we have decent protection when it comes to the Delta variant, but if the virus mutates, as we know it does, then that's not going to hold us in good stead. Which brings me to my next question, because in the UK, for instance, in the last 24 hours, 50,000 daily new cases have been recorded, and the Delta Plus variant is now believed to be behind this surge. What more can you tell us about that?
So Delta Plus is the other variant of interest, which is also in some extent a concern in India, because that Delta lineage is also being seen in our country, especially the AY lineage, the AY4, AY12. But the issue here is that we still need to have more data as to whether this is becoming a variant of concern from a variant of interest. Wherever the Delta Plus variant has been reported in our country, there has not been a huge surge in the number of cases. So it seems that in our country, the variant, the lineage of Delta Plus probably is not that aggressive or is not that infectious. But I would say that we still need to be very, very cautious as we move ahead. The next few months are very critical and we need to be very careful in terms of COVID appropriate behavior.
Right. We're seeing that UK curve up on our screens, and there's clearly been, yet another uptick in cases. But Europe too is seeing a COVID surge ahead of winters. Is there a looming global wave?
So there is an increasing number of cases being reported from various countries, and you're right, from Europe, UK, and even from some parts of the US. And there is this concern that are we seeing a new resurgence of the virus in certain parts of the country? In certain parts of the globe, and is that related more to people who have not got vaccinated, or is there a breakthrough infection occurring?
Yes.
We need to really look at it from that point of view. Currently, there are a number of people in various parts of the world who have not got themselves vaccinated fully, and they are susceptible to infection. So we need to really sort of tease out how many of them are having breakthrough infection and how many of them are having infection because they have not got themselves vaccinated and therefore are susceptible.
Right. I know, I know that you're essentially explaining that we don't know whether the surge is because of the unvaccinated or because of breakthrough infections. But broadly speaking, what do these numbers tell us about the effectiveness of the vaccine or the shelf life in a certain sense of vaccine efficacy?
So this is a tough question because two things are there. One is that if we look at the number of cases, we have to see whether the increasing number of cases is going hand in hand with increasing hospitalization and increasing deaths. If that is not happening, that the cases are increasing, but hospitalization and deaths are not increasing, then one could say that the vaccines are effective and they're holding out because they are preventing hospitalization and deaths. And that is the main function that the vaccines have. On the other hand, if we find that there is increasing hospitalization and increasing deaths, then of course the vaccines are not that effective. Their efficacy has come down, and we either need to look at a booster dose or the next generation vaccine, which covers for these new variants, will have to be considered.
I'm going to come back to the question on booster doses, but at the moment, if I could just ask you an allied question on Delta Plus. There were cases of Delta Plus that were reported here in India as well. Is this variant more transmissible? Should we be worried given the fact that this is what is believed to be behind at least the UK surge for now?
So the Delta Plus has multiple lineages, and we need to really see what was the lineage in the UK as compared to India. But there is always a concern that the virus will mutate, and we will have certain changes or mutations which make it more infectious or make it allow it to attach more easily to the ACE receptors, and therefore that needs to be evaluated more closely. It is likely that we may have some Delta Plus lineages which may make it more infectious, but whatever data we have from our own country doesn't suggest that currently that is happening in our country. But we need to remember that this world is very well connected, and the Alpha variant came from UK to India and caused the increase in the cases that we saw in the beginning of the second wave. So any surge in any part of the country with the new variant is a cause of concern globally.
All right. So we should be looking at what's happening in the UK, with a sense of caution. Now, India's crossed, the great milestone this week, Dr. Guleria, 1 billion vaccine milestone, indeed something that makes all of us very proud. But the question that I want to ask you is, do we need to diversify our vaccine basket because we've largely relied on 2 vaccines to get here?
So I think we are diversifying our vaccine basket because the DNA vaccine ZyCoV-D has also been approved. We are looking at new vaccines from different companies, a new mRNA vaccine and viral protein-based vaccine also. So I think in the coming months we will have different vaccines, and then the next question comes, which vaccine should be given for which group of patients? Is it that a certain vaccine will be more useful for children as compared to adults? A certain vaccine will be more useful for elderly as compared to the younger age group? And then what should be the booster dose? Should it be the same vaccine or should it be a different vaccine? So these questions are still there. They will evolve with time. But I think we will get more vaccines in our basket, and that will help us to further enhance the vaccination program, because that gives us more doses.
Speaking of enhancing the vaccination program, the Pfizer, has come out and said that its vaccine is 90% effective in kids. And the million-dollar question, I know we've asked this to you several times, is when will India have a vaccine for children? We know there's one in the pipeline, one approved, but nothing in the market for our children just yet.
So, two vaccines have been sort of approved. One is, of course, the Zycov-D, the DNA vaccine, and the second is the Bharat Biotech vaccine, which also the experts have approved to be used in children. So, one is now waiting for it to come into the vaccine schedule and be able to roll it out, and that is being worked out. And I am pretty confident that very soon we will have the vaccine rollout for children. In my opinion, when we have a vaccine rollout for children, we should first focus on the high risk group, those with comorbidities, children who have low immunity or may have a chance of having severe COVID, because they should be the ones that should be vaccinated first. Healthy children usually have a mild infection and they could be vaccinated subsequently.
Well, absolutely. There has to be a roadmap for the rollout of vaccinating children. But why has the drug controller not approved Covaxin for kids yet, even though the SEC has recommended it?
So that question, I can't answer that question. The drug controller can answer that question, but I'm sure that it will get resolved, because if the experts committee has approved it, then it should not be much of a problem.
Typically, the time frame between an SEC recommendation and approval is much smaller than what we're seeing in Covaxin for kids, which is why I asked you that question. But the WHO approval for Covaxin, is still pending. One is hoping that it will come somewhere around month end. What's the anticipation around that?
So again, one is very hopeful that this should happen this month, and I hope so. WHO had wanted more data, which has been given, and I think that should satisfy them. They have their meeting scheduled, so hopefully we should have approval from the WHO as far as Covaxin is concerned. There have been a number of studies which have been done, which are not industry sponsored, but by separate investigators, and including our own institute. And we've found that it is an effective vaccine. It's a safe vaccine. Therefore, I think the data is there. We've also sent it for printing, for publishing. So it should be peer reviewed and be available for the public and the researchers to read. And I think we will have more data in the coming weeks as far as the efficacy and safety of Covaxin is concerned.
Dr. Guleria, many questions on how long vaccine-induced immunity lasts. And the reason I ask this question again is because there's a big debate on when boosters need to be given to those who were vaccinated in the first phase, because we vaccinated our most vulnerable population, our frontline healthcare workers in the first phase. Do people who were vaccinated in the first phase still have vaccine-induced immunity? What more can you tell us about a timeline for boosters?
So this is an important question for which I don't have a definite answer, because we need to really find what should be the timeline. We can't look at antibody level and then decide. It will have to be time-based. That if you've had a vaccine, say 1 year ago, then you should take your booster. But we need to have more data on that. Now, if you look at what's happening in the UK, we are seeing a surge of cases in the UK, but we are not seeing an increase in hospital admissions or deaths in UK because of COVID. Now, UK started its vaccination in December. So if we are not seeing that, that means the vaccination that were given in UK in December seem to be holding out till now, because it's still not there. We are still not seeing more hospitalization or deaths, and the vaccine is still protecting people against hospitalization and death. So if we keep that in mind, then in my mind, we are still in the safety zone as far as hospitalization and deaths is concerned from the virus right now. But like I said, if the virus mutates and it decreases our immunity level, then we will have to look at a booster earlier than later.
Right. Sooner rather than later, boosters are going to be given, because that's what's happening globally. But do we have any kind of rough time estimate on whether it will happen, at the 1 year mark, or, do we have any clarity on what India's plan of action is going to be when it comes to giving boosters, especially to the vulnerable?
So I don't think there is a clear-cut, there are a lot of discussions going on, but I can't say that we have a clear-cut decision. But I think that it would be sometime next year that one would look at boosters, because that will be the 1 year mark. And it will be likely that one would focus on the more vulnerable population to begin with, those with comorbidities and the elderly to start with, because those are the ones who could have more severe disease.
All right. Well, I think that's an important development that we'll watch out for. Meanwhile, Dr. Guleria, it's dengue season. One does know that given the festive season, COVID is very much around. Many people have actually asked, how can one differentiate between symptoms of dengue and COVID, or should one compulsorily get both tests done if at all symptoms come up?
So it's sometimes the symptoms can overlap, and if there is a doubt, it may be worthwhile to get both tests done in the early stage, and an RT-PCR and a blood test for what we call NS1 antigen. But there are certain subtle differences. COVID is a respiratory viral infection, so it usually causes cold, cough, sore throat as one of the manifestations, common manifestations. Dengue is again a viral infection, but through mosquitoes, and usually causes high-grade fever with headache, body aches. Later on, there can be a skin rash, but what predominates is the headache, body aches, and severe and the fever, which is high-grade. Respiratory symptoms are not that common in dengue as compared to COVID. But like I said, there can be certain overlaps, and therefore, you must consult your physician, and if there's a doubt, it may be worthwhile to get both tests done.
All right. So worthwhile to get both tests done. I think that's important. Is dengue worse in post-COVID patients, or for that matter, are post-COVID patients more vulnerable to viral infections?
So as far as dengue is concerned, I think the most important thing is that we must make sure that we are able to prevent mosquito breeding in our house and around our house. And in terms of allowing water to collect and making sure that, especially in pots and on the roof, there is no water collection. Whether dengue can be more severe, there is some data which tends to suggest that in post-COVID, you may have more severe dengue, but I don't think we have enough data right now to say one way or the other.
Okay.
But those people who have post-COVID fatigue and other syndrome, that is long COVID, in them, if they have dengue, then their symptoms tend to become more severe because of both the things adding on.
And would post-COVID patients be more susceptible to viral infections in general?
No, that is not there, that post-COVID patients are more susceptible to dengue, because dengue is a vector-borne disease.
Right.
So if you have mosquitoes in your area, then you are susceptible, you can get dengue. If you don't have mosquitoes in your area, you will not get dengue.
All right. Well, Dr. Guleria, thank you so much for answering all our questions so very patiently.
Thank you.